Thank you. Hello, I'm Gabrielle DeTora, as you said. I am a healthcare marketing strategist. I have almost 24 years of experience working with hospitals and healthcare systems around the country. I've worked as a head of marketing for 2 different health systems before starting a health division of an advertising agency and running that for several years and working with many different clients across the country. And then for the last 2 years, I've been a private consultant working with hospitals as well as advertising agencies, strategic planning companies, and really allowing the value propositions to be stronger for their clients as well. So that's a little bit about me. So today we're going to really talk about the value of women's health and health services throughout the continuum of care model. We're going to talk about how to really identify and understand the voice of the customer and what your competitive set is so you can create a strong value proposition when packaging your women's health services, and then how to take that through the continuum. So when you're launching campaigns, you can really drive downstream revenue with women's health across the whole continuum. Let me ask you, out of those people in the room, how many have women's programs currently? Can you put your hands up a little higher? Okay, great. How many of you have full continuum of care models? Okay. How many have OB? Mostly OBGYN? Okay. What about cancer? Mostly cancer. Okay. All right. We're going to talk about all these models, but I just wanted to be able to adjust what we're talking about to be relevant to what your needs are. Also, this is a very interactive presentation, so please feel free to jump in. We have lots of fantastic case studies to share with you, and I really want to get past some of the educational side and into the case studies so you can walk away with some really excellent, tangible ideas that you can apply right away, and you can see the success of some of those ideas. But if you have great ideas, if you've had things that have been very, very successful, please share that with the team. There's a whole group approach to this. So feel free to just call out. We're going to talk about a couple of quick facts that you can walk away with when you're trying to get additional resources and justify women's health in your institutions. We're going to go over knowing your women's healthcare market, just a little light introduction. I'm curious to see how many people use some of these tools, don't use some of these tools, as far as market research, and really have an idea of what your consumer needs from a needs assessment standpoint, where your competitors are, what their positioning strategies are, and really how you're using your assets in that package and that communication channel. We're going to talk about actually packaging the women's services in a way that adds value to the community. And then, like I said, we're going to get right into the case studies, applying the insights that you learn from some of these techniques that we're going to talk about and transforming that into powerful campaigns. And again, it's all about the downstream revenue and being able to track that. We're also going to give an excellent case study that talks about launching a bariatrics program and the immediate success that they had in the combination of using traditional and new medias and some of the trends that are going on in women's health communications. And then we'll save some time for Q&A. So women's health. Women basically own the buying market, as we all know. And 85% of all consumer purchases are made by women. But as you can see, 80% of healthcare decisions are made by women. This is a huge market. So when you're talking about packaging women's services and providing women's services, it's not just about the women. It's about capturing that gatekeeper, that 35 to 54-year-old that's making all of the decisions for their families, for their husbands, their kids, their in-laws, their parents-in-law, and really building that loyalty with that woman who's going to control the rest of the dollars in your marketplace. So kind of think about that as we're going through this. That statistic was from the Bureau of Labor Statistics. Another one is 60% of all doctor's appointments are made by women. Usually the woman is making the appointment for her members of her household as well as herself. 59% of prescriptions are ordered by women. And keep that in mind for those of you who have retail pharmacies. This is a very, very powerful market. Again, that gatekeeper you're trying to build a relationship with. And for those of you, there was lots that had OB. I had an idea that maybe there would be a lot of OB platforms here. That basically every single OB maternity patient you have transitions to about $4,000 in downstream revenue within the 3 years following a birth. So that's an immediate statistic that you can take back. That statistic is from the Healthcare Advisory Board, but Thomson Reuters has an excellent study that they also talk about this and came right in that $4,000 mark. So that's a pretty good statistic to use when you're benchmarking.
Gabrielle?
Yes?
All this in our contract to write down statistics?
Yes. Yes, it is. As a matter of fact, we have a lot of resources that we're sharing with you. Some of it is in here. This is an article that was published last year on this topic, so you can refer to this. And there were some really fantastic case studies, all of which we couldn't pack into this presentation. So some of them are from Franklin Street, and really wonderful ones from women's cardiac services, bariatric services, so really across the continuum. We put a lot of them in the appendix, so if we have time, we can certainly get into some of those and share them with you. If not, I'm just going to pass around a pad. If you guys want to give me your email addresses, I can upload the full presentation with the full appendix in it if you're interested in receiving that. I always love show and tell items. And there's some very good ones. Okay, so this is a really powerful market. So what is influencing their decisions? So the first thing I wanted to ask was, how important is the physician and their opinions when making a judgment call of what hospital that you're going to go to? So I called up my wonderful resource, Linda McCracken at Thomson Reuters, and she gave me some great information on a study that they did. And as you can see here, the female audience is this, I guess I should use my little pointer thing, this lighter off-white line, and then those who have had a maternity stay within the last 12 months is the darker green here. And we all know with choosing maternity, obviously it's the one service line people want to go to the hospital for. It's practically the only service line people want to go to the hospital for. So obviously that, environment has a major part to do with this, the patient experience, the luxury style that's being offered. So those are the real things that they go after. So we were kind of curious about the comparison between that and the rest of the female market for every other service out there, regardless of the age of the female audience. And so what we found is that those who would use another MD, because that MD was not having them go to the hospital of their choice, was almost 16% for those who had a maternity stay, because of course they have that loyalty, they have that wonderful experience, they love the hospital, they have their son or daughter there. So that's really not surprising, and about 8% for every other woman. But here's where I found some interesting statistics, is those who would ask the MD to send them to their preferred hospital. And you actually have total women is 53%. It's higher than those who just had a maternity stay, which is at 43%. So this tells me that women are obviously researching the hospitals. They're researching it for things other than OB, and they're influencing where they go because they're self-selecting. And then it goes down to such an extreme here that they would be willing to switch doctors. And then this last category is those who, will go because of the doctor recommendation first and foremost, and that's in the, the 33% category. So when you're thinking about how you're going to market, who your target audience is, obviously there's a clear appreciation for marketing and building a relationship directly with the woman. It's very important. If you can get the doctor too, you get, upwards of an 80% loyalty build, you're golden. But what we're going to focus on today is really this 53% and really influencing the women and building a relationship with a woman and really engaging with her life and making her life easier. So what does she use to decide where she's going to go in order to ask her physician, can I go here? These are some key attributes from that same Thomson Reuters study. And you can see, can you guys read this okay in the back? The top line, 77%, is obviously hospital is covered by the health plan. That's a no-brainer. But then, there's no surprise. It's the good MDs, the good nursing staff, the reputation of the service line that they're going after is very important. So that service line marketing is going to be critical moving forward. The overall reputation of the organization. Technology obviously is a 52%, so highlighting if there's an opportunity in the marketplace because you have a Da Vinci, etc., has to be tied in there somehow. But I thought this was interesting, that offers a full range of care is 51%. So those of you that are using this opportunity to build the relationships with the women in your community, and you're only talking about OB, or you're only talking about breast care, we're a little bit missing the boat here. So we have to think about it in a broader context of how we can build that relationship with the women in our marketplaces. And here's again that referred by the physician at 45%. So this is really to give you an idea of those attributes. So it really matters about the attributes within your marketplace, within your service lines, and they vary pretty widely. If it's OB or cancer or neurosciences, these vary. So to find out what's true in your marketplace. So understanding your audience to build the ideal brand experience is going to be very, very critical. I'm just going to kind of go through these quickly because I really, like I said, want to get into the case studies, but there's some examples of what these look like in this article if you don't use some of these. Sometimes it's a little difficult to picture what this might look like. But the first one to take a look at is the competitive service offering. Really having a good idea from the attributes that we just discussed, who has the outstanding doctors, who has magnet nursing status, who has better technology, who has different awards, as well as the services themselves. Is there any opportunities there because you have a service line with access and capacity that your competitors don't? Just a good understanding of where you stand next to all of your competitors, because that's going to go in how you're packaging your services based on the needs in the marketplace. The market share obviously is something you guys look at again. I highly recommend that you drill down into the age cohorts by zip code. A lot of times we just kind of look at the big picture and take that overall is how we're communicating with the females in the marketplace. If you drill down into the age cohort, it makes a huge difference in the attributes and in how they're making their choices about women's health. As a matter of fact, there's a really great presentation I recommend you all go to from Thomson Reuters tomorrow that's on drilling down into the age cohorts with the female market. Then you take a look at the preference share, because the market research, as far as market share, is the reality of what's going on. But the preference share, which is through your market research from telephone surveys, online surveys, etc., gives you the impression that people have in their minds or the perception of what's going on. And if you do a gap analysis, those things don't always line up. So you're going to ask questions about that, and those insights are what's going to feed your focus groups later on. So you can really understand the voice of the consumer, what matters to them, why they think they're choosing one place but they're actually attending another. That's going to be very important when you're packaging your services and creating those marketing campaigns. Last visit share. Are you guys familiar with these terms? You guys use these already? Last visit share is in the last 2 years. Where did you or a family member that's part of your household go to the hospital, and what did they go there for? Again, match that up with the same year data from your market research, and you can see, where there's a gap, and start questioning those gaps and being able to change that perception. And then again, the key attributes by service line is incredibly valuable, because that's going to affect how you position your services. You might think that you have the best technology and you really want to share that, but if it doesn't matter, from, say, OB, technology falls down lower on the ranking list, usually, but to really have an understanding of what's going on in your marketplace and what does your consumer that you're trying to identify and build a relationship with care about in the first place when it comes to the services. So take a look at that. Share of voice. Share of voice is really, once you identify, what's going on, where do you want to market, what do you want to market, this is about how you're going to market. And share of voice is specific to the media spend in the marketplace, as well as the digital clout that you have online. So it's taking a look at the competitive spend overall. If you guys already know this, I can zip through this. Do you guys do a lot of this already? Yes, no? Okay. So to take a look at that, so you know how to position and ask for your budget resources. The competitive positioning obviously is taking a look at the messaging strategy and coming up with something that's very unique as a value proposition and your offering set. And then benchmarking access is something that kind of falls off the radar a lot of times. But with something as important as, say, breast cancer, when people are really scared, access is really, really important. You don't want to be marketing something that's going to have a 3-month waiting list. You're terrifying the patient, and then they're going to go to your competitor. And all that work you're doing is just growing your competitive market share. So having a good idea of that. And then taking that information and really getting, again, into the voice of the customer with the focus groups is going to be incredibly valuable. So you come away from that, you see where your opportunities are in the marketplace, and then you start packaging your services. A lot of women's health, again, kind of falls into certain buckets. We're going to go through some of those buckets, but it is not a one-size-fits-all, and it certainly is about what's true to your marketplace and what you have as your service offering. So it doesn't have to fit in sort of the models that we're going to share with you, but we're going to give you some models, and also as part of the appendix, there's examples of some of the best women's hospitals in the country that fall into the different buckets that we're going to talk about. But these are all the different programmatic elements that can go into your women's services. So the first model we're going to talk about is the continuum model. And I'm going to ask Merri to chat about that. Oh, I can just go through these really quick. I'm sorry. There's continuum model, the breast care model, OBGYN model, the membership model. And then when you get into the services like Navigator or the concierge, they kind of also are in some of the models above, but some of them really use that as their platform entirely. So we're going to talk about that. And then the virtual package, which we're not going to spend much time on, but that's those services that are really about the hospital overall, that are digitally wrapped in a bow on your website. But there's no programmatic element to the continuum or patient-centered care model in your hospital. So we're not going to talk as much about that, but most of the hospitals in the country kind of fall into that category. Yeah. Another statistic that was in here from She Economy is that women don't feel understood, especially in healthcare, to the tune of 66% of women feel that way. So you need to be talking to them in a voice that is theirs, that they can relate to. So certainly calling it a women's program and giving it a personality in how the care is delivered, as well as how you're marketing it, is going to be vital. So I do believe that is important. So just to wrap up, in the next 25 years, there's going to be nearly 30 million women in our population, and it's only growing. And they're very, very powerful decision makers, and they're driving the demand with healthcare. So we definitely need to build relationships with them. So if you take away nothing but the points on this slide, consider the comprehensive and unique needs of women patients. And this isn't just their bodies and how the delivery of care model is working, but it's also the psychological side of this, and really connecting to them in a way that is very, very personal, and again, connects to them in their age range with their healthcare needs. It really irritates a lot of people in focus groups that I've had when they're getting a lot of OB materials and they're, in their 60s. It's like, well, this hospital has no idea who I am and doesn't care about me. They're just mass mailing. You can be much more specific, save your budget, and build the relationship. The one-size-fits-all does not work, obviously. To measure the full impact of the downstream revenue, I love the statistics that you shared from your campaign. That was only the female market that they were targeting that's having that net of, over $6 million. But there's ways of tracking that where you get the whole family, and it's a multiplier. Yeah. And that's really where the value comes into play with these women. Understanding the factors that drive their decisions and really focusing on it. Again, taking those attributes that we talked about before, doing the research in the focus groups and applying it in a very smart way when it comes to your packaging and branding, and the different kinds of vehicles that you're using. And then increasing the trust and satisfaction of these women, really building that relationship is absolutely vital, because women appreciate value in a different way and want to be communicated to in a very personalized way. Well, thank you all so much. I really appreciate it.